So I've pierced ears for many years, and my left ear, just the hole kept getting stretched from just wearing heavy earrings, or I think it's mostly from talking on the phone or from leaning on it, etc. So this ear was stretched, so earrings became harder and harder to wear and to stay in place. So I'd heard this procedure existed where they just stitch up the hole.
So Amy came to us with torn earlobes, a really simple thing that we can correct for patients easily without any complication.
I had been looking online and I ended up finding this office, and when I came in and I explained that I put it off for a really long time and I'm a little nervous about needles and stitching, etc., they were really comforting and sweet. So then I came in and met the doctor, and Dr. Epstein was very reassuring and told me exactly what the whole procedure would be, which was just like a few stitches, and it went really well. It was really 4 or 5 stitches in my ear, and it was pretty easy and not painful at all. And so then I just get it re-pierced and I can wear 2 earrings again.